Welcome in my room at UMCG, where you can see how pathology changed in recent years, because this microscope is becoming obsolete as we are now scanning biopsy slides. Here you can see an example of ANCA glomerulonephritis, an immune-mediated disease that can severely affect the kidney. But apart from establishing a diagnosis, much more information can be obtained from a tissue sample. Most of my research centers around the development and continuous modification of international classification systems that are used, for instance, for the prediction of patient outcomes. Artificial intelligence and rapid developments in the genetic background of kidney diseases are important new players in the field. Moreover, many new therapies are currently developed for kidney patients. Our most important challenge for the near future is to find out whether there are clues in the tissue that give an indication which therapy would give the best possible outcome in a particular patient. My name is Ingeborg Bajema and I'm a professor of nephropathology.